Hello everyone. In this session, we are going to discuss the important topic that is autoimmune disorders of thyroid. So basically, we will be discussing two important disorders here, the Graves disease and Hashimoto thyroiditis. In your university exam, you usually get either a short question on them and rarely on the Graves disease, you can get a long question also. So let's start it, autoimmune disorders of the thyroid. You can see we are starting the topic that is autoimmune disorders of thyroid. We will be discussing two disorders here, Graves disease and Hashimoto thyroiditis. So let's start it. So before understanding the autoimmune disorders of thyroid, first you must understand the normal thyroid histology. Otherwise, you cannot understand the topic. So first I will let you know the normal thyroid anatomy, the normal thyroid histology, and then I will come on the topic that is autoimmune disorders of the thyroid. So I will give you an introduction. What do you mean by autoimmune disorders of thyroid? And then we will start the two diseases one by one, that is Graves disease and Hashimoto thyroiditis. So for each of them, first I will let you know the introduction, then age, then gender, then pathogenesis, gross, microscopy, and clinical feature. And in the end, we will compare the two diseases back to back under these headings so that the concept will become crystal clear in your mind. So let's start it. So let me tell you the normal thyroid anatomy. So thyroid is a gland which is present in the neck over the trachea, and you can see there are two lobes. You can see this is right lobe, you can see this is left lobe, and the two lobes are connected with each other with isthmus. So this is the normal anatomy of the thyroid. You all can see this is the normal anatomy of the thyroid. So thyroid is a gland which is present in the neck, having the two lobes which are connected with each other by isthmus. It is present over the trachea. The same outline of the two lobes, you can see it here also, the right lobe and the left lobe, which are connected with each other with isthmus. You can see it here also. Now inside the thyroid, how many type of cells are present? Inside the thyroid gland, two types of cells are present. So if you see the histology of thyroid, you will see two type of cells. Number one, entire cells, the cells which are lining the follicles, these are the follicles. So the cells which are lining cells in the follicles are known as follicular cells. Can you see? These all are follicular cells which are lining the follicles. These are follicular cells. And the cells which are present intermittently here, these are known as parafollicular cells. Now what does this secrete? The follicular cells secrete thyroid hormones, that is T3 and T4 in the blood, and parafollicular cells secrete calcitonin in the blood. So follicular cells are secreting T3 and T4 in the blood, and the parafollicular cells which are present in the interstitium, they secrete calcitonin in the blood. So there are two type of cells, follicular and parafollicular. So this is the normal histology. You can see the same here, the thyroid gland, the right lobe, the left lobe, the isthmus, having two type of cells inside them. Now this is the diagram of a normal histology of a thyroid gland. Can you see the entire cells are arranged in small follicles? These are known as follicles. I want you to appreciate the lining of the follicles. These all are follicular cells which are lining the follicle, and the background is known as stroma. So let me highlight the stroma. I want you to highlight the stroma. Can you see the stroma? This is all stroma. So let's highlight the stroma. And in the stroma, few interstitial cells are present which are parafollicular cells, and they secrete calcitonin. So this is the normal histology of thyroid. Now in the normal histology of the thyroid, you have understood we have follicles. So let's draw the follicles. The follicles are lined by follicular cell. So these are the follicular cells. They are tall, columnar, or flat to cuboidal. So these are the follicular cells, and in the background there is stroma. So I want you to appreciate the stroma in the background, and in the stroma we are having parafollicular cells. So we have sparse parafollicular cells in the background which secrete calcitonin. This is normal histology of the thyroid. Now if you understood this, let's start the topic. Nobody is going to ask you all these things, but it is for your understanding. In your exam, if the question is coming on autoimmune disorders of thyroid in university exam, you have to start writing from here. That was for your understanding. So let's start the topic, autoimmune disorders of thyroid. What do you mean by autoimmunity? What do you mean by autoimmunity? Listen, human body, whenever any microorganism or any foreign particle enters in human body, what happens? So inside the human body, we have defense mechanism. We have army in our body. Who's the army in human body? The army in human body, the defense mechanism in human body is the WBC. Okay, what happens when a terrorist enters the country's territory? You tell me what happens. Whenever a terrorist is a foreign particle that causes harm to the country people. So whenever any terrorist enters the country territory, the army of that country get activated, and there is a fight between the army and the terrorist. army destroy the terrorist. So that happens in human body also. So whenever any foreign particle enters the human body, that can be a microorganism, that can be a bacteria, virus, fungus.